This is the November 18th edition of Commissioner's Office Hours. I'm Kara Kumari. Thank you all so much for joining us today. Just a few reminders as we get started. Chat box is open, so if you do have questions, please put them there. We will, of course, start like we always do with the questions that were submitted ahead of time, but hope to have time to answer questions in the chat box as well. Another thing, we are going to be ending at 10 o'clock sharp. SPPC meets today, and as that is a statutorily required meeting, we will, of course, not have anything that overlaps with that. And finally, you are automatically muted, so you will not see a mute button by your name, but rest assured you are muted unless you are a panelist. So hopefully we can have a good and productive meeting. And with that, I hope everyone is doing well, and I am going to turn it over to Commissioner Turner to start this meeting. Commissioner, good morning.
Good morning. Thanks, Kara. Good morning, everyone. Hope you guys are all having a good week so far, and happy Wednesday to everyone. As Kara said, we certainly look forward to these conversations every week. I'll be very brief because we do have to cut it off at 10 o'clock for the meeting. So just want to welcome everybody again. Thank you for the questions that you've submitted. Please make sure to continue to utilize the chat box. We certainly take those questions and try to research them and provide some solid feedback and answers to you for the questions that you've got. So looking forward to the discussion today. We've had a very productive week. A lot of you folks probably saw our budget presentations. We got a lot of good feedback on that. So thank you for your kind comments around that. Certainly looking forward to some continued discussions as it relates to things that are going on. We're very busy right now, but that's a good thing. So holidays are busy and work's just as busy. So I'll turn it back to Kara and we'll get started. Thanks, everyone.
Great, thank you. Just a couple of updates from my end. The comment period for the second round of stakeholder input for IDD integration has closed. We did get more than 100 comments and are working to digest those and take a look at those and do what we need to make sure that we have appropriately got all of it sectioned out and read all of it. So thank you all very much for submitting your comments. Also, just a reminder, we did have a family-focused presentation for families about the Katie Beckett program on Monday. A recording is available on the DIDD Katie Beckett page. Just to give people the, in case you were unaware, that program will open up for applications starting at 7 a.m. Central on Monday, November 23rd. So that is next Monday, and 7 a.m. Central is when the self-referral questions will appear in the TennCare Connect portal. So we are definitely looking forward to that. Of course, we're asking people to be patient because we do expect a very high volume of self-referrals to be filled out in those very first few days. So with that, I will turn it over to the questions that we have pre-submitted. First question is will you all have a WebEx for ISC's case managers and ECF case managers like you have had for BAs and nursing? I would say this, the therapeutic services BA and nursing forums were very successful, and credit to Dr. Davis and his team for some very good, forums and the feedback provided by all of those groups. And we are always looking at ways that we can utilize things that have been successful and bring them to other areas. So we are definitely reviewing those, how those went and moving forward in the future with those. Next question is, we are part of the 1915C waiver and also have ICF homes. We do not participate in ECF, so have never contracted with the MCOs. Since all agencies need to contract with the MCOs prior to July 1, what is that process? I'm going to turn that over to Deputy Commissioner Jordan Allen, see if he has any insight. Jordan.
Thanks, Karen. Good morning, everybody. So the short answer is yes. All provider agencies currently in the 1915C network on July 1st will be deemed as acceptable and available providers across the ECF network, and that goes for ICF also. So if you're currently providing ICF services, you will need to reach out and initiate contracts with the managed care organizations, obviously supporting the persons for whom you provide service, and they will establish contracts. And then again, to take that to the second level, the plan after the deeming process and agencies contract appropriately for services that they're providing, then the plan is to align credentialing requirements and eventually end up with a single network of service providers across all services. That's a little bit down the road, but yeah, you need to reach out to each of the managed care organizations, and if you're currently providing services, you'll be deemed as of July 1, and you will contract with the managed care organization to ensure continuity of service.
Thank you very much, Jordan. Okay, our next question is going to be for Dr. Bruce Davis. Will those who are employed in an IEID or other long-term care setting have the opportunity to be vaccinated under Phase 1C of Tennessee's vaccination plan, as well as those reside in the settings? And will the state be covering the cost of staff who choose to be vaccinated? If not, who covers these costs? Dr. Davis, can you provide some updates on where we are on that process?
Yeah, I'll go ahead and answer the last question first. There is no cost to the vaccinations that are going to be coming out for the recipient of those vaccinations. So those are given at the freely by the state to try to get a handle on this pandemic. I'm going to be kind of limited in what I'm going to say about vaccinations right now because the plan is still evolving. However, I do want to say that DIDD is meeting tomorrow to discuss vaccinations. And, you know, I can suffice it to say right now that our population and the staff who support them, that the Department of Health recognizes the vulnerability of our population and wants to ensure that we get a very high priority in getting these vaccinations. And one of the kind of counterintuitive things associated with this is it's likely that as a sub priority that the staff are actually going to be prioritized above person supported, because TDH has recognized that it is the staff really that is the greatest source of spread within our systems. So that is, there's more to come, more information to come on this. I just wanted to give you a little bit of information. As the plan develops further, we will give you more definitive information as it becomes available. Thank you, Kara.
Commissioner, do you want to add anything?
Yeah, thanks, Kara. Dr. Davis, I just want to echo what he said for the providers and the folks that are obviously in our network that are aware of the news about the vaccines and stuff. This is something that we're placing at a very high priority, and Dr. Davis has done an exceptional job from a clinical services perspective, making sure that we continue to challenge ourselves around the right protocols, wearing masks, social distancing, hand washing, things like that. So as soon as we have a concrete plan in place relative to the vaccine rollout for person supported, we will prioritize making sure that we share that information with you, because I know that's at the forefront of everybody's mind right now. There's a lot of hope built around the vaccines, but it's certainly not going to be the silver bullet type fix for this pandemic. Still a lot of stuff we've got to do and a lot of work we've got to do to make sure that we get it right, but understand that that's a very high priority we've got right now as a top focus inside our department. So we will certainly make sure we communicate to you anything that changes from a rollout plan or anything that's going to impact person supported. We're gonna make sure you know about it as soon as we do. Thanks, Kara.
Great. Thank you very much, Commissioner. Thank you, Dr. Davis. Dr. Davis, I'm coming back to you. Is DIDD assisting in facilitating testing for those in the waivers and ECF? If so, are there a list of testing sites? Dr. Davis, do you want to give an update on where we are?
Yeah, so we did some mass testing back in May and June of 2020, but we're not doing any mass testing at this point. If there is a need for somebody to get path group testing, we can arrange that through our regional offices and the regional office nursing directors. But by and large, we're expecting agencies to do their testing on their own. And so the Department of Health has arranged for people to be able to order Everlywell tests or P23 tests. Both of these are self-testing kits If you want more information about that, contact COVID-19 at covid19.testing@tn.gov, and they can give you more information about the testing and getting yourself established to be able to do that. Carol?
Okay, and then we have one more question that was submitted ahead of time. Can you give us an update on the department's efforts to include TENCO in the discussions about TheraP? I am going to turn this over to Deputy Commissioner Andy Kidd.
Hey, good morning, Karen. Good morning, everybody. Thank you very much for the question. So it's a great question. We had a really productive call earlier this week with Jared from TENCO, and just had a really good conversation about what that'll look like when it comes to TheraP. And so we are working to get a demo for TheraP for providers so that you guys can see what we're looking at right now. As a quick update, we've actually worked with our internal IT division here at the state, and so we've got a project manager that's going to be, getting all the requirements from the providers, from our subject matter experts, and then that way we can make sure that we have the best system moving forward. So I'll be glad to answer any questions about that. Thanks, Kara.
Thanks a lot, Andy. I appreciate the update. Okay, that was our last question that was pre-submitted. So now I'm going to go into the chat box. First question, due to difficulties, we switched from P23 to Everlywell test for our staff. Does anyone know what we should do with the unused P23 tests? I sent an email to the COVID-19 box and did not get a response. Dr. Davis, do you have any insight?
Yeah, well, if that's the address that you used, I was keying on that a moment ago because that is that's our address, and I'm not sure when we can respond to that if we didn't, but that should be covid19.testing@tn.gov to get information about the tests. I doubt they're terribly concerned. I don't know how many that you have that you haven't been able to turn back in, but I would contact them and ask them what the disposition of those tests should be. So that's I would just contact covid19.testing@tn.gov, Carol.
Thank you so much. Appreciate that. Another question for you, so stay on. Will we be able to continue using Everlywell tests with DIDD sponsorship after December 2020? Dr. Davis.
Yeah, that question has not been evaluated yet, or at least has not been, no answer to that question has been communicated by the Department of Health. So as we get information about that, we will let you know what's going to be happening. Carol.
Excellent. And then question for Dr. Davis. Will agencies be able to mandate that staff and persons supported take the vaccine? Not sure we're really there yet, but I'll turn it over to Dr. Davis.
Well, so this is going to be an important question, I think, going forward. Mandate is a strong word, and they will have to consent to getting the vaccine. There's no question about that. The question is, how do you respond to that as an agency if someone says that they don't want to take the vaccine? There are some varying approaches that you might have to that. It might limit the person's job duties or something else associated with that until the person supported are able to get vaccinated, because you certainly would like to see a scenario where everybody within the setting gets vaccinated so everybody's equally protected. But that, we will be giving you some more information on that. There will be a consent form associated with this that people will have to be informed of what the vaccination is, what the risks are, and so forth. And they'll have to make an independent decision, though, about whether they're going to sign that form. It will then be the agency's responsibility to respond to that. Kara?
Great. Somebody asked if we have updates on positivity rates in the DIDD populations. Dr. Davis usually has the rates, but I'm going to first go to Teresa Sloan with our updated numbers. And she can provide where we are, because we have seen a very large increase in the numbers of people who are testing positive?
Sure. Kara, like you just said, Bruce Davis can give the rates. I'm just going to give the raw data. For provider staff, we've had 1,435 positive tests throughout the pandemic. And for persons supported, we have had 674 positive tests and 6,055 negative tests. And that's just a basic raw data, Kara.
Thank you very much for providing that. Dr. Davis, do you have any other insight on positivity before we move on?
That was roughly a 10% positivity rate. Our positivity rate remains still probably a little bit lower than reality, partially because we did so much mass testing back in May and June. So that is kind of suppressing that number a little bit. I would say, and I have not calculated this number recently, but more recently we've had a much higher positivity rate than that, which is concerning. But I do want to also say that we talk about these concerning numbers all the time, and they are concerning. We had a day here in Tennessee where 8,000 people, nearly 8,000 people, tested positive for the coronavirus. I kind of expect that to increase more as the winter progresses, but it's not a hopeless situation. I just want people to really not think that it's hopeless, because I think when people don't wear masks, when they don't take the proper precautions, they're kind of treating this situation like it's hopeless, and it is not hopeless. You can do things to make a difference with this, and that includes wearing the mask, washing your hands, staying socially distanced, staying distanced in all activities to the maximum extent possible. I'm not suggesting that we should shut everything down, but we should be very, very cautious about these things. And if we do these things, there is hope around the corner. We can work our way through this thing, and eventually this vaccine's going to come along, and then we're going to be able to move into a different phase of all of this. But until that happens, these things are what we can do, and they do make a difference. And there is hope in this, and we can save people's lives by doing these things. So these are critical things that I think people just really need to think about, and don't be hopeless about it. We are going to get through this. We're going to make it to the other side. So hang in there, everybody. Kara.
Thanks very much, Dr. Davis. And I know with everything going on and, people's schools starting to talk about going back to remote or already having gone back remote, it does seem, with rising numbers and everything that's going on, it does seem like it's, the light at the end of the tunnel still seems very, very far away. So thank you for that encouragement. Any other questions? Not seeing any. We actually just got one. Could you provide the number of deaths per person served? Reviewing and sharing mortality rate helps with continued encouragement of being diligent. Teresa, do you have those numbers in front of you?
I do. And Kara, I think as of last week, we started to include that on the COVID page. So I just want everyone to know that number is there. The total death count as of yesterday is 29 for people served in the 1915 ECF and ICFs.
Excellent. Thank you very much, Teresa. Any other questions in chat? All right. Well, we got one. Does DIDD have access to N95 masks, medical gloves, and PPE gowns? Andy, do you know what PPE we are currently able to access, or do you want to talk about procurement? Or Dennis Watson, who is our contact with TEMA, might have insight as well.
Yeah, Kara, so we do have supply of different types of masks, medical gloves, and PPE gowns. We're still working towards procuring additional N95 masks that's something that we're working towards. We still encourage all providers to look for your own sources where you can. Obviously, we're here to supplement where possible when you have positive cases. But when it comes to N95 masks, we're still encouraging each provider to look for their own source for that, although we are still looking ourselves. I don't know if Dennis has anything to add on top of that.
Yeah, we can request N95 masks from TEMA and other PPE as we have been in the past. That program is still going, and actually I've seen quite an uptick recently with it. There is some requirements with the N95 masks that come along with it with requesting from TEMA though. When you're requesting for large amounts of them, i.e. I had a request for 1,000 last week, that there are things that have to go with that, because you're competing with the hospitals and the first responders. It will be a challenge to get the prioritization for the N95 masks. And if you do get approved for the N95 mask, there's an expectation that there will be some Battelle Decon system usage with those masks. So when you get the masks, you wear them, then they have to be packaged and sent to the Battelle Decon system. They can be cleaned up to 20 times before they're no longer safe to be used anymore. There's about a 30% rejection rate with those. So if you order 1,000 and you use 100 of them this week, they need to be packaged and sent, and the next set used, and you just got to keep cycling through them. So there is a logistical component to that. And the Battelle system is free, but you do have to register through it, and I can get you information if you need that information to assist with extending the longevity of your current masks you got. And I can put in requests if need be. I just cannot guarantee that you will get the prioritization, especially with the uptick in cases that's being seen nationally as well as statewide.
Thanks a lot, Dennis, and thank you, Andy, for providing some insight into some of these requests and what some of them might look like. Okay, it is 9:53. So with that, so that we can prepare for SPPC and other meetings, we will call it a day. First, though, we will turn it over to Commissioner Turner to see us out. However, one thing I do need to mention, there will be no office hours next Wednesday being the day before Thanksgiving, to give people time to prepare their safe celebrations for Thanksgiving. And looking forward to seeing you all after that, after the holiday. With that, I'll turn it over to Commissioner Turner.
Yeah, thanks, Kara. And again, thank you everyone for the questions today. And I just want to continue to drive home what Dr. Davis said and what Kara just alluded to there. We're going to get through this, everybody. We've already been in the thick of this for over 7 months. And I know it seems like it's been an eternity and it has been a long time, but we've got a lot of resiliency in us as a people, and we certainly have a lot of resiliency inside the state of Tennessee, and we're going to make sure that we beat this thing. And we're going to outlast it. We were talking yesterday that, with the vaccine on the horizon, it's almost like it's a goal line stand that we have to make now against COVID, where COVID's trying to get in the end zone, and we've got to stop it until the vaccine gets here. So please continue to be safe. But most importantly, don't lose sight of your blessings and things that you're thankful for. As Thanksgiving's coming up next week, we still live in the United States. We've still got an incredible amount of blessings and benefits around us that we lose sight of sometimes. Because we see things differently than we probably should. So as you gather next week with family and friends in a safe environment, just take a second to count your blessings and be thankful for all the things that we do have, and the fact that we live in a country that has a robust scientific community that's creating a vaccine for the virus, and that we've got a community that we work very closely together with. And I'm grateful for the work that you do. I'm grateful for the work that the DSPs do. And that's one of the things that we're really thankful for here at DIDD, is the partnership that we have with you that's developing and going to continue to develop. So count your blessings next week. I certainly hope everybody has a great Thanksgiving, enjoy some time off, and then gets ready to finish 2020 strong and head into 2021 with some good momentum as we're moving forward to change the lives of people that we care about and the people that we support in Tennessee. So have a great Thanksgiving, everybody. Thanks, Kara.
All right. Thank you, everyone, for being with us today. We're so happy that you joined us. I hope everyone has a safe and happy Thanksgiving, and we'll see you on the other side. Bye.